by this I mean even the nurses as well,
Yes.
doctors and nurses, even as you respond to that.
Now, let me respond to this and I come to the mismanagement part. Fred, this is one relationship, we call it an incestuous relationship. It's an incest of some sort. Because
the one between UON and Kenyatta?
Between UON and Kenyatta National Hospital. You have students who are coming in for postgraduate studies who are attached to Kenyatta National Hospital as a teaching institution and who pay fees to the University of Nairobi and offer free labor to Kenyatta National Hospital. Not free per se, because patients who walk in pay for that service. And you want to call these people a worker. This is not a worker. A worker has to have a remuneration.
Yes.
You cannot define a worker by saying there's a volunteer. No. You either have a volunteer or you have a paid worker. You have to define that. The University of Nairobi has to sit down again with the Cabinet Secretary, management of Kenyatta National Hospital, and redefine that relationship. Right now, we have two of our senior registrars who are actually even taken to the Parliamentary Health Committee about this Kenyatta case.
Because they have to answer.
Yes. So the buck stops with who? Who bears the burden? They can wash themselves and say, me, I'm a student of the University of Nairobi. I am not an employee of Kenyatta.
I'm a volunteer.
I am a volunteer. I use my skills that I'm learning. I've never been chased away from Kenyatta because I'm a student. And they will be absolved by law because the buck doesn't stop with them. Is there a contract that the University of Nairobi has signed, which I believe exists with Kenyatta National Hospital? Can we have that contract publicly? And then poke holes in it and see how we can remove that which is not working and strengthen it for it to work fine, completely for the betterment of health. If
you are CEO, how would you rework that kind of relationship?
The first thing I would want to have is definition of how we're working together. Number one, what are the reporting structures? Do we need, independently from the University of Nairobi and Kenyatta National Hospital, to have an independent committee that manages this relationship? That does not exist. That independent committee will now be answerable to the boards of Kenyatta National Hospital and to the University of Nairobi, such that issues like this that touches both institutions can actually be mitigated for by these committees. That's one thing. That's actually a very easy solution that they can be able to do.
Yes.
The same committee can actually instigate a probe or a survey to find, even from the stakeholders who are the registrar themselves, the professors who are teaching, and the other doctors who are offering their services there as workers, as healthcare workers of Kenyatta National Hospital, and see how is it that it can become better. I mean, the lecturers who are from the University of Nairobi and KNH are on strike. And one of the key areas is saying you did not implement the CBA.
Yes.
At the end of the day, they are doctors.
Yes.
You cannot say because you're a doctor at KNH, you're a doctor of the University of Nairobi, you're not. They work in Kenyatta National Hospital. Address that. Now, back to your question, second part of the question, is...
Are we mismanaging
We are mismanaging. From a management perspective, I'll tell you, there are two components about job satisfaction in a patient. It's not about... In fact, there's a... Let me bring a theory. There's a working theory that has been put out there that explains what makes a worker stay where they work. One looks at motivation. Another one looks at satisfaction. Motivation and satisfaction are completely, totally different things. A satisfied employee will be the one who will come in, will be paid, from what the union are saying. I give you like 300,000 and you say, fine, I'm okay with the salary. I ensure you have a medical cover, you're okay. I ensure that your children or there is transport available, I am okay, I'm satisfied. But am I motivated? Individually, when you look at this healthcare worker, what are the things that mean a lot to them? One, let's look at gender issues. When I am pregnant, are there changes and shift? When I come from maternity and I'm breastfeeding, as the new act talks about, institutions should be able to set aside breastfeeding rooms and all that for mothers. Do we have provisions for that? KNH does not have provisions for that. So a pregnant doctor, a nurse, or clinical officer in KNH does not feel motivated.
And Kenyatta Hospital should perhaps be the,
it's a health institution.
The best
and
medical facility.
And it's not just Kenyatta, it's everywhere. I mean, we've seen...
Of course, if you don't have it at Kenyatta, you don't expect it at level 5.
Fantastic. Now, when you look at that, and the thing about satisfaction is training. We have nurses requesting for training, and their requests are being rejected. We have doctors from county requesting for training, expertise that is required. If you look at the disease burden in this country, the top 10, we are moving away. In fact, now we are at almost at 50-50 ratio, infectious diseases and non-communicable diseases at 50-50, meaning we need to inject into the system, to the workforce expert. You're rejected. A colleague once was told, we don't need a neurosurgeon. A county said it doesn't need a neurosurgeon, yet it does not have any neurosurgeon. Why? Because they look at the length of time it's going to take for training this doctor, 6 years, but they don't look at the outcomes. I mean, if you do a cost-benefit analysis, how much does it take to just pay this doctor for 6 years and bring this doctor back and save lives? Looking at the demographics of Africa, and Kenya to be specifically, you will see that our workforce is within the youth. We have a very huge population, about 60% who are the youth. Meaning that if the health of this population is not taken care of, in the future, Fred, we are going to have an aging